I've got an ITB question too. I don't know whether it's for James or Damian though, but is it a bike fit issue or is it a tendon issue? And you talked about grotty Achilles, and I was thinking, you know, we've got grotty ITB, but is there a similar sort of...
Well, what's ITB for those that don't know?
Yeah, well, hopefully this is kind of what you're talking about. So the ITB is effectively, it's technically a tendon which runs down the outside of the thigh. It's two muscles on either side of your hip, turns into a common tendon and attaches onto the outside of the knee. Now what can happen is there's a bit of bone just on the outside of the thigh bone, the femur, and for a variety of mechanical reasons that can rub and you sort of get, it's historically called ITB friction syndrome, because as I'm running, every time I take a step through a certain movement, there's pressure placed between the tendon and the bone, and it manifests itself as basically running related pain on the outside of the knee. Okay. So in terms of the pathology, what's going on, an ITB problem and an Achilles problem and virtually any overuse problem are all manifestations of the same issues. So, which is why I use the Achilles as an example, but ITB would definitely fall under that bracket. And so you can manage that. You can manage that pathology. The funny thing about tendons is their relationship with the muscles that they're attached to. And we have this phrase that muscles are like buffers for tendons. And basically, if you work a muscle and the tendon that's attached to it, the load that goes through that is always, if you run and you weigh 80 kilos or whatever it is that you weigh, every time you hit the ground, you've got 80 kilos passing through that unit. You can either have the majority of that going through the tendon, and that'll wear it out pretty quickly, or you can have the majority of it going through the muscle, and that's really well designed as a buffer. Okay, so it's not, so the whole strength thing is kind of, there's a lot to it. So whether it's an Achilles thing, if you can strengthen the calf muscles, that acts as a buffer to protect the tendon. Likewise with the ITB, if you're strengthening, it's principally the gluteal muscles. If you can strengthen those, then that acts as a buffer to this tendon. The other nifty thing that happens if you strengthen the glutes in the right way, and this is the important thing, and the point I'd probably stress that Merv said, is that, most people that I see and I say, oh, have you been given the clamshell exercise? They're like, yeah, I've done probably thousands of these. Well, the problem with that is that's kind of cool for some things, but if you want to get strong, you have to actually push a heavy weight. And doing 8,000 clamshells is just simply not going to make you strong, and it's not going to give the stimulus to that muscle to do its job as a buffer. So you've got to do some really, you saw a great video of that step up that the young girl was doing there. That's the kind of load that you need, and in doing so, it's neat in terms of, you actually get some meaningful strength to offload that.
Can I just add to what he said, just in terms of what does meaningful weight do? In that video, that girl was, and please don't anyone do this, she had 150% of her body weight on the bar. Yeah. So it has to be meaningful load.
And am I guessing she's not some elite hero athlete or wrong?
She goes okay.
No, that's not out of the realms of...
Oh no, not at all. Yeah. You get that with training. Yeah, absolutely. I suppose what's the thing between that girl who's done a little bit of it and let's say you or me is that our physiology and the way this operates is really no different, acknowledging gender, age, and a few other genetic differences, but we largely operate with the same system. The difference is her entry point. She's pretty darn strong and has done a lot of those, so she can go in and do that happily. Now, you end up in a car and in the back of an ambulance if you've not done that before and you try, and so that's where the kind of science around coaching is establishing what's appropriate for your injury and you and getting that off the ground so it's efficient early rather than banging away on 8,000 clamshells and going, well, I've been doing this for 12 weeks, that's not changed. Yeah, so it needs to be meaningful weight, but what meaningful weight is for everyone is entirely different. Yeah.
So if I bring in the bike side of it there, I guess my general comment with this ITB friction is it's very seldom caused by bike riding. It's much more commonly it's a loading, it's a impact injury, which is about the running. But once it's irritated enough, we'll see it also irritating on the bike. And I will see people come in for treatment on it who are only cyclists, and we see common things. And you pick up the strength. As soon as we put a video on front on, you can see that things are collapsing around the hip, or you can see the knee coming in towards the top tube. The extreme versions is I see people got bruises on the inside of the knee. I think we had one only just the other day, because when they're pushing down, they've got nothing happening around the ITB glute muscles there. The knee comes in, they bash in there, and the other big thing is, as the knee comes in, it winds that tension up there as well, and then it'll rub. So there's certainly things that we can manipulate. So if someone's getting sore on the bike, we go, okay, can't run at all, it's way too sore, can ride a bit but it hurts a bit. That's something we go, okay, well, there's some angle changes we can do, there's some cleat position things we can do to give it the best shot. And the other thing about it, of course, is it's a tendon, and underneath the tendon is a bursa. Sometimes there's an inflammation in that, and now and again, this is where some anti-inflammatories or getting a sports doctor involved is very, very useful to help rapidly speed these things up when we're a bit short on time. So
That's great. Thanks, gents. They're both very helpful.